Hello, my name's DeWitt Wilkerson. As we've had an opportunity to work in clinical practice under the concepts of complete dentistry for almost 30 years now, as well as working with thousands of dentists in hands-on settings, there are some great clinical tips that can be of so much help to us as we seek to help our patients. And so I'd like to share some of those tips with you to help you in your practice. In practicing the concepts of complete dentistry, we understand that we're evaluating the total masticatory system as we work with our patients and their occlusal needs. One of the things that we're going to focus on is the fact that centric relation is the starting point for all predictable occlusal therapy. So what do we do with a patient who comes in who has tight muscles, who's difficult to get into a centric relation position, and yet we want to be able to help them immediately? One of the greatest aids that we've found, one of the simplest tricks that we've found through the years, is a simple deprogrammer. This is a Lucia jig that is made by Great Lakes Orthodontics. What we'll do is, if a patient comes in and their muscles are tight, we'll simply place a Lucia jig or deprogrammer right between the teeth. And what this does is separates all the teeth except the very most anterior. It will allow the lateral pterygoid muscles to release. It will allow the elevator muscles to take the joints all the way home to centric relation. It'll do what we call clearing the dance floor. In other words, we're eliminating any noxious contacting teeth that may be stimulating the neuromuscular system to activate the lateral pterygoid muscles. And so in using this, what we'll do is very simply, we will take, I like compound sticks because they work very well. They're very simple to work with. You can heat the compound stick very quickly. Place the warm compound in the well of the deprogrammer. Work with it till it's doughy, not hot and sticky. And then we'll simply go to the patient's mouth and press this up over the central incisors on the top and press it out across the labial so that it'll adhere there. Hit that with air and water. Have the patient close until their incisal edges of the lower incisors just touch perpendicular, nice and 90 degrees, and we're ready to go. At this point, what we'll do then is, with the teeth separated in the back, we'll have the patient rub their jaw forward and rub back, rub forward again and rub back even further, rub forward and rub back as far as they can, and then tap, tap, tap their front teeth together and relax there for about a minute or two. Typically what you'll find is that if there are tight muscles or opinionated muscles in the system and you place this deprogrammer in for literally not more than a minute or two, most people will loosen up and be able to hinge freely and be able to go to that centric relation seated jaw position very easily. So this is a super great help, something that I would really encourage you to try. They're very inexpensive. You can get a whole box full of these deprogrammers from Great Lakes Orthodontics and begin to work with these for deprogramming muscles.